Alright guys, so my name is Salik from Hills Dental Boutique. Hills Dental Boutique was established back in 2023, December. I have worked in many dental practices before that for over 10 years, all over Sydney, from Central Coast to South Coast to Sutherlandshire and City. Finally, back in 2020, I met Dr. Jessica. That was her best day that she met me. So that's when we kind of decided that, you know, we should work together, and I have worked with her since 2020, and then on 2023 we started to do this business together in Rouse Hill. This is my team. Oh, wow. There you go. All right. So that's my team. We started from 4 people, and now we are nearly 16 or 17 people. You can see I'm the only flower between these tones. Life is hard, guys, yeah. Who am I? I was born in Afghanistan, came to Australia back in 2004 when I was 16 years old. Went to Arthur Phillip High School, Newcastle University, Sydney University, did all my studies. I have a beautiful family, 2 girls and my wife, who's an immigration lawyer. As you can see, I love soccer, I love adrenaline stuff, and also I go gym a lot, so this is, yeah, pretty much. Also, I'm a bit of a part-time social media influencer, mainly with dental. I do dental coachings, I do teach graduates, or business coaching for dentistry as well on the side. Hills Dental Boutique, pretty much in the heart of Rouse Hill, a very good location, away from the hustle and bustle of the shopping. Really nice car park, really good area to be at. Basically, that's our building. Then you meet us, you fill up the form with an iPad. Everyone gets a scan of their teeth where we can see, we can show the teeth from like different angles, from 3D. I remember Koshal came to me and we did a 3D scan of his teeth with his picture. Not only he wanted to change his teeth, he wanted to have a facelift as well, and you know, have a second wife for his retirement as well. But I said no. And then you could. Not really. Not yet. You do a checkup and clean with like a EMS Airflow, which is a Swiss brand, warm water, no noise. It's very spa looking kind of thing. Whoever has come here, I'm sure they have experienced it. And obviously me and Dr. Jessica, and also I've got a visitor, Dr. Simiti, who some of you guys have already seen her doing your dental work. We discuss the treatment plan. We start with the service in terms of like anything from check-up and clean, gum treatment, filling crowns, mouth guards, appliances for airways and sonoring, Invisalign, clear aligners and braces, cosmetic dentistry, which could be whitening and veneers, dental implants, and also any type of family dentistry. All right, sorry guys, sorry about the images, but this is what I could come up. This is one of our patients, Dean, who wanted to get married. Obviously, he got married, but before his wedding, he wasn't happy with his smile. He had a lot of problems, from gum disease to alignment to fillings to cavities to discolorations, everything. So how dentistry work? It's like pretty much like construction. You start with the soil and slab, which is the soil and slab of the building. Mainly that's the gums and bone. So we try to stabilize that first, get rid of the gum disease, get rid of the termites pretty much from the building before you bring new appliances. So that's what we did. We did a bit of a gum treatment first, and then alignment of the teeth, fixing up all the general dentistry, root canal, fillings, and then eventually once the teeth were aligned, we did some veneer work for him and pretty much got him ready for his wedding. And he's living in South Coast Wollongong now, and he still comes every 3 months to us with his wife for his maintenance. So dentistry is not just like home. It's not like you've built it and you shouldn't be maintaining it. It actually runs on maintenance. Another story, this is Nicole, all the way from Newcastle. Nicole had some small teeth, but obviously very healthy. Gums were very good, and a bit of discoloration. She just wanted to have like uplift and have like some veneers. These are porcelain veneers. So what we did was we did a bit of a checkup and clean, some whitening of the bottom teeth, and also 10 veneers to just cover her smile line without any corridors, anything at the back. And those teeth are looking very natural. If I go back to Dean's, it's a bit super white. That's what Dean wanted, but obviously not for my liking. Obviously you don't want to walk out with like piano keyboards on your teeth, or like as well as what I say is toilet bowl in your mouth, pretty much. So, but these teeth are looking more like natural. I normally suggest that the whiteness of your eyes should be matching the whiteness of your teeth. That's how you're gonna get a natural look, which is very important, and nothing like that. So yeah, she had that. I couldn't put her face photo for obviously private reasons, but it's matching really nicely with her whiteness of the eyes. Another 15 years old Sumida, who is local in Sydney, obviously wanted Invisalign or straight her teeth. That's how her teeth were before the Invisalign, and that is how it is after. Believe me or not, this result was achieved in 25 weeks. So it's like pretty much under a year. Normally Invisalign takes anywhere from 4 months to 12 months. It's much faster than braces. Braces regularly takes 18 months. But this Invisalign case, 25 weeks from day to day. Very, very good. Obviously, we also give her retainers, so we can retain her teeth long term, and she has to wear them every night. Or we can do a fixed lingual retainer, or to kind of keep it like that. Next is implant patients. So we do a lot of implants. So first of all, this first picture on the right, it's called individual implant, missing tooth, and then we replace it. And the other one is a full arc implant. So it's I don't know if you guys have heard of all on 4, all on 6. So that is actually, yeah, we have replaced it. Implant actually is just like reinforcement in the concrete. It actually holds the bone from losing. So it's very important. If you're missing tooth, you're missing bone. How are we different? We have state-of-art equipments. Very, very boutique. We are not like a production line. Top 1% diamond provider of Invisalign worldwide. Very aesthetically driven. Over 310 reviews counting. All 5 stars. Who's a good referrer for me? Anyone anyone who has teeth and no teeth. haven't seen this tears, having bleeding gums, wants to straight teeth, hide their smile, or missing teeth. Yes, so guys, your mouth is the gateway to your body. Healthy gum should never bleed. Cosmetic is always the bonus of having healthy mouth. And thank you so much. Yeah.
I've just got to say, if Dean can get a partner with teeth like that, there's hope for all of us. Just saying.